Hi, I'm Sandy Thomson, your host of Life Ahead here on PBS 39. Now, if you've ever had back pain or neck pain, this is the show you want to watch because we have Dr. David Lutz with us here tonight, and he's going to be able to answer any questions you might have in that area. In fact, we have a phone number that you see on the screen right now that we'll be showing periodically here. Jen Headley is our director, and she'll bring that phone number up every now and then to remind you what it is so you can call with your questions. Let me welcome Dr. David Lutz again with us tonight. No stranger on Life Ahead. It's always a joy to have you with us.
Well, thanks for having me again. I always enjoy coming.
Good. And again, he enjoys questions and handles them very well. So there's no question off base tonight, right?
That's correct.
Well, at least if it's in your topic.
Right.
Yeah, we'll put it that way. You know what I want to start with, and I know we're going to be getting into some interesting areas tonight. We're going to be talking about a neurostimulator that can actually be implanted that will help with pain.
Yes.
But we're also going to be talking about other non-surgical treatments for back and neck pain as well. But I want to start, Dr. Lutz, if you would, by kind of giving an overview of the spine and areas that cause the most trouble. And I know you have some pictures with you tonight.
I do. I always think it's helpful for the viewers, and especially new viewers, to understand some of the basic terminology that we use and understand the mechanics. So when we talk about things later, it makes more sense.
Sure.
So if we could bring up the first slide, we can talk about the spine itself. And really the spine is a chain of bones, and the purpose of the spine is multifold. I mean, first, it supports upright posture. It's complicated because our back has to bend and twist and rotate, and the spine has to be able to accommodate for those changes and forces.
It has a lot of work to do.
It really does.
I mean, what would we do without a spine?
Yes.
Well, we wouldn't be sitting here, for one thing.
It also has to protect the spinal cord, and it has to protect the nerves. And, we have to rely on the spine. We use it every day, obviously, and if there's a problem with it, it can really cause a lot of pain and dysfunction.
May I ask, what do people do that damages their spine the most? I'm sure you see a lot of people coming in saying, I knew I shouldn't have done that. What are some things people do that cause problems?
Sure. Well, first and foremost, what a lot of people don't do is exercise the back, because our back has to be strong. If we are, let's say, a weekend warrior that's going out and moving lots of heavy loads, but yet during the week we never exercise the back, or prone for injury in those situations.
Weekend warriors, a lot of them around here. In fact, a lot of them happening right now with warmer weather on the weekends. Exactly.
Absolutely. Projects around the house, for example.
Yes, exactly. One of my friends mentioned that she is aware that you have to have your stomach muscles also can help support your back. Is that true?
Yes, absolutely. It's important to have a strong core as well for good spine mechanics. And there are a lot of muscles in the spine too. It's not just bones and discs. There are a lot of paraspinal muscles that go up and down, and it's very complicated, and it's important that we have those muscles to be strong and in good shape to prevent injury in the first place.
Are there exercises one can do to strengthen those stomach muscles that will help, again, with the back?
Oh, absolutely. There are definitely exercises that can be done to help with that core strengthening, and that's really important for our patients to understand, and when they're in the office we can go through some of those with them.
You're not going to demonstrate for me right now?
I'll bring my gym clothes next time.
Okay, all right, and we'll get into that. All right, let's go back to some of your pictures and explanations of what is what in the spine.
Sure, if we can bring up slide 2, we can take a look at the discs. We can see the pink structure in the middle, the intervertebral disc. The disc is very important. The discs act like shock absorbers because, we move and flex and bend, and there's a lot of shock that is accommodated by the spine, and that's kind of like a jelly donut almost that allows the back to absorb that type of shock. And we can see the yellow structure right next to that pink picture of the disc there, and that's the nerve. So one can see how close that nerve is to the disc. If we can pull up slide 3, we can now take a cross-section of that pink disc and look at it from above.
Yeah, the top down.
Sure, and we can see in this picture on the inside we have the disc nucleus, and that's more of a jelly-like substance. And on the outside is what's called the annulus, and that is a stiffer type of structure. And we can also see the yellow nerves once again, and then the spinal cord would be in the middle. Now, if we have degeneration of that annulus, if we have cracks there, we can have some of the disc material bulge out, protrude out, and that can push on nerves, and that can cause pain in the arm or leg, that can cause weakness, that can cause numbness, so that can cause a lot of dysfunction in our patients.
Because you're putting pressure on the nerve by what is bulging,
right,
or what is escaping from the disc area.
Definitely, and slide 5 even shows that better.
Slide 5, oh my, okay.
So we can see how there's a crack in that outer aspect of that disc, again, which is pink, and then you can see the contents of the inside spilling out through it. You can think of the outside as like a tire casing that's kind of blown in this situation. Then the contents of the inside can push on that nerve, can cause the severe pain. For example, the sciatica pain you may have heard terminology for in the past, and there can be a lot of inflammation that goes on as well, and that can cause a lot of dysfunction and disability and a lot of problems that we treat.
I hear people use that term a lot, sciatica. I've got sciatica, or sciatica pain. Where's the sciatica? Is it one place, or is it a term that refers to any disc area?
Well, sciatica refers to leg pain, and all of these nerves and nerve rootlets actually form and travel and ultimately form the sciatic nerve. So we can have pinched nerves from the back that ultimately travel into the sciatic nerve that causes the quote-unquote sciatica pain down the leg. Now, there's also other structures that are in the buttock region, like the piriformis muscle. If a certain muscle gets irritated that's right on top of the sciatic nerve, that can cause sciatica too, because it's causing that pain down the leg.
So maybe what also people need to keep in mind is if you have pain in your legs or perhaps even your shoulders or arms, it may be originating from your back?
Often it is, absolutely. And we see that all the time in our clinic.
Okay, all right. Okay, now, we have any other close-ups here we want to show people so that they're aware of some of the vertebrae structure?
Yes.
What are bulging discs? Is that the same thing as what you just showed me in terms
of
the jelly-like substance escaping?
Right. That's considered a herniated disc or extruded disc, but it's all a continuum because we can have some discs that start to bulge and then they can protrude and then they can herniate and extrude. So it's all along a continuum there.
Okay. By the way, we're getting some phone calls in already, and we appreciate you watching, and we appreciate you participating by giving us a phone call with your questions. And I will mention, by the way, if you prefer to not talk live on the air, and we love when you do, but if you prefer not to, we have Roz answering phones in the control room, and she'll type up your question and send it out here on the teleprompter to me in the studio so that I can ask you those questions. Let's see. All right. Carolyn is calling in, and she says this: by flexing my glutes, I can pop my lower back and sacrum. Is that correct? Sacrum area when I sit too long. If I don't, it's stiff. Why would this happen? And are there any exercises that can help them? You understand everything Carolyn's asking? We have kind of a two-part question here.
When people feel popping in the lower back, a lot of times that can be related to the joints in the back. And since this is an offline question, we can pull up a picture of that to show that a little bit better. Number 19, if we can jump to that slide, that shows a picture of some of the joints in the back. The joints allow us to bend forward, which is flexion. It allows us to bend backwards, which is extension. And the joints can be pain generators as well. As we see in this picture, the joint is inflamed, and that's what the red marker is trying to depict here. And those can be pain generators too. And when we feel, popping in our back, just kind of like when we crack our knuckles, those joints can be affected as well. So as I mentioned at the beginning of the show, it is important to have good, strong muscles to kind of hold everything in place and so forth. And, those joints sometimes can pop and crack, and often it's helpful to see either a physical therapist or a chiropractor to work on some of these issues mechanically.
Is it dangerous if you would you hear popping or just feel it?
Sometimes you can hear it. More often you notice it and feel it.
Is it dangerous?
It depends what's going on in the back, and that's why it's good to have some imaging to know if there is anything, like you just mentioned, dangerous or not.
Right.
In and of itself, it's often not of big concern, but it's always good to know what's going on if someone is having symptoms.
So keeping flexible and maybe even doing some movement as you're sitting might help so that when you don't stiffen up so much.
Right, and there are different pelvic tilt exercises one can do even.
Let's do it now, a pelvic tilt.
Yeah.
I don't know.
So there are some exercises that can be done to try to improve those muscles in that lumbosacral region to keep them stronger and keep the pain down low. I've had back flare-ups myself, and I've had to do these even at the office at work between patients just to stay strong and on top of that.
And stay flexible.
Absolutely.
Okay. All right. And again, don't forget to give us a call here. We have several more minutes yet in the show for you to have an opportunity to ask Dr. Lutz your questions. I have a question about this object on the table. This I know is a neurostimulator. That's about as much as I know about it. Dr. Lutz, if you would explain what this is used for.
Sure, absolutely.
And who does it help?
And what I'd like to do is have you guys pull up slide 15 as well, and then we'll show the picture and then focus on the model here today. Neurostimulation is a type of treatment for chronic, long-standing pain. This is for a small population of our patients. Those
like reoccurring over a long period of time?
Yes, and those patients who perhaps have tried injections, have tried surgery, have tried strong medications, but still, despite everything, have, for example, ongoing low back pain and leg pain. So this is an implant, and we can see the picture on the left showing at the bottom aspect of the flank there is a device, like a battery, and that's connected to wires that actually go up the middle of the spine. And we see on the right some of the leads that are present, and I'll show the model right here.
Now, is this stimulator actually implanted?
This is ultimately
that's not
implanted.
On the outside
this
of
is
your
all
body.
on the inside, just like a pacemaker is implanted.
All right.
This can be implanted too. And the viewers can see here the neurostimulator device. This is the battery, actually. And then we have the lead wires that you can see on the table as well. What we do is we place the lead wires into the back itself.
All right, these are the lead wires.
That's correct.
There'd be one or multiple?
There can often be more than one.
Okay.
Absolutely. And then that is ultimately hooked up to a generator like this, a battery. And what it does is it delivers electrical stimulation to the spine to help cut down pain.
In a certain area? Like
That's correct.
Right at a nerve, or where does it? I'm assuming that you would implant these and run the wire up with an X-ray type of thing so you know exactly where you're putting it.
We do, and the purpose of neurostimulation, again, is to cut down pain that's chronic, pain that's ongoing, pain often that is nerve-related. And what we do is we implant this wire, and there are two parts, actually. The first part is where we can do a trial or a test drive to see if our patients have improvement with the therapy. And what we do is like doing an injection with a needle. We will place the lead wire through this needle, ultimately pull out the needle, and then have this wire hooked up first externally or on the outside to a device similar to this. And we actually have another picture that we can pull up that shows what I just described. If we can pull up number 20, that would be helpful to further talk about this.
Right, so this is like your experimental way to find out if this works for you?
Yes, it is. We do a trial for about 5 to 7 days So the interventionalist, the doctor, will place the needle in the right spot of the back where the opening is, and we take x-ray pictures to follow our work, and then we take x-ray pictures and insert this lead wire into the epidural space of the back, and we gradually push it up under x-ray guidance to the final resting spot. And then we'll test whether or not the electrical stimulation is covering the area of pain of our patient, and we can adjust it, do some fine tuning and manipulation to make sure we're covering the patient's low back pain or left leg pain, for example. And it can be really a life-changing therapy for the right candidate.
Would it be an instant relief for them, or
it can be? Yes.
Can it?
And many
what
times,
a miracle that must be for some people that
definitely
have tried everything.
Yes, and it's really interesting to see our patients in the post-operative recovery room feeling so much better, and we often see that. And then when the patients will come back to me when the trial is over with, many patients don't want the lead wires pulled out because it's the best they've felt in a long, long time.
And afraid if you take them out, they're back to pain.
And then what happens is, after the trial is done, then the more permanent implant is implanted under the surface of the skin, so that no one knows that they have that type of therapy, just again like a pacemaker.
Yeah. Now, you said that they have a battery in them.
Yes.
Things with batteries, though, can the battery die out pretty fast, or how do you know it's even getting weak?
It depends on usage, and the representative can use their instrumentation to know exactly when the battery will run out. And these last for years and years, at least 5, 6, 7, 8, 9, 10 years, depending on the usage. And some of these are rechargeable from the outside, too, and they even last longer.
Cool.
Yes.
Okay. Can you control them yourself in any way?
You can. You can turn it on and off when you want to. You have a programming device and a control device that has different settings.
A little remote control, huh?
Right. So if you want to cover different areas or use different intensities, that can be programmed and guided by yourself, basically. So
that's pretty much a miracle. I mean, to think that, like, ooh, I'm getting this pain, I need a little extra help here, and adjust it.
So you can adjust it and turn it up.
Today I feel good, let's turn it back.
Right. And there is some newer technology, like in our cell phones now, it knows what position our cell phone is in, and the devices have that built in too. So for example, if you're in different body positions, it can automatically turn up or turn down the current and stimulation as well. So they're smart too.
That's amazing.
Yes,
it
it's
is
very
a
exciting.
Little computer.
Right.
I mean, it just simply, all the new technology is pretty much a miracle when it comes to back pain, which has been around forever.
Yes.
We have another phone call, this time from Hannah, and this is Hannah's question. She has a degenerative arthritis in her back, but she has pain in her arm. Why could the pain in my arm be in my arm and not in her back? All right, so she's got degenerative arthritis in her back, but she gets the pain in her arm. Why?
Yes, well, that, assuming that when she says back, she means lower back, the arm pain would be related to something possibly separate, because the nerves that go down into the arm come from the neck. So we would think that possibly there could be a neck condition, or there could be a condition in one of the peripheral nerves that run down the arm. Sometimes people can have pain in the arm from an orthopedic or mechanical condition. So that's why we do a lot of testing to look into the cause and etiology of the symptoms, whether that's getting an MRI, for example, of the neck, or doing an EMG nerve test. That's something that we also offer at our center, and sometimes x-rays, depending on what's going on. So arm pain won't be coming from the lower back.
Not the lower back, but maybe the upper spine?
Possibly, yes.
In the neck.
Right.
You know, I often hear people talking about having arthritis in their back, but I think, I'm just guessing, most of the time they're talking their lower back. But
usually.
You can also get arthritis at the top of the spine.
Oh, definitely. If you can get it at the bottom, you can get it at the top too.
Oh, okay. So maybe that's Hannah's issue. Hopefully, yes. Hannah, that has helped you out here a little bit. Okay, now, one of the other things I want to talk about tonight would be non-surgical treatments. Now,
yes.
the implant is surgical, but it's not like...
It's not as invasive as a big fusion or something like that.
Exactly,
right.
exactly. It's just implanting that small device.
Mm-hmm.
And as far as the other pain treatments...
If we want to pull up slide 12, we can talk about another one.
Okay, let's do it.
Slide 12 shows a decompression table system, non-surgical decompression that helps a lot of our patients as well. Discs can bulge and protrude like we talked about. If we can help unbulge some of those disc protrusions, draw necessary oxygen, fluids, and nutrients, we often help out the matter a lot. And slide 13 shows a closer up picture of this, and it indicates here this can treat bulging discs, herniated discs, degenerative discs, the facet syndrome, that's the joint pain that we showed before, and even the sciatica pain in the leg. The decompression is also for the neck too, so we can do the same thing in the neck as well. This is a mechanical type of treatment that can distract and position correctly the segments, so we can zone in and target the right discs and help try to unbulge those areas, reduce pressure in those areas to try to allow the discs and structures to heal and improve.
Oh, okay. All right. So decompressing the back or the different areas in the neck or the spine that can gradually give them some relief. And this would be a series of treatments.
It's a series of treatments, usually about 20 or so. And when we're upright, we're always putting pressure on those discs.
We are. I mean,
when we're sitting, when we're standing, we're always putting pressure on those discs so that if there is a treatment that can help reduce that, that often can allow things to heal. Because a lot of people with back pain have it for a long time, and for a lot of folks it just doesn't get better. So this is an exciting treatment that helps many of our patients.
We have another patient who has just called, another viewer, perhaps you're a patient. I'm sure you have been at one time or another if you have a back or a neck pain. This is Sarah, and Sarah says, I have pain in my neck causing my arm to swell. I have heard doctors say it's lower, I think, doses. Would that be correct?
I'm not sure if they mean doses or discs. It's hard to understand the question, but pain in the neck and pain in the arm can be from discogenic or disc pain if that irritates some of the nerves.
Discogenic.
Yes, discogenic is a way to describe that. And depending on where the discs are, that can influence which nerves are affected and which area of the arm hurts. Again, assuming that's the cause.
Okay.
Sometimes you have to think about other causes if there's swelling, like circulation issues or other mechanical issues as well. Again, important to see the doc.
So a neck pain, something that's certainly causing a problem in the neck could potentially cause your arms to swell. Is that what you're saying?
No, what I'm saying is pain in the neck and irritated nerves in the neck can cause pain that shoots down the arm. Okay. It doesn't always cause swelling, so that's why we have to...
Swelling could be another issue.
Could be something else, so that's why we have to really get that checked out. Sometimes we'll do ultrasounds to make sure there's not a blood clot or something like that going on. Sometimes people can have circulation problems that can cause swelling, but everybody's problem is different, and a situation like that really would require a physical exam.
You know, I think it'd probably be good to advise people to not necessarily take advice from a neighbor or an aunt or somebody else, because, you know, if they say, well, yeah, my back used to hurt and this is what I did, well, it could be 100 different reasons, and it may not be the same one.
Yes.
We have Greg just calling, and Greg says, would a decompression table help a person with a slip disc? Oh, good question.
The answer is a clear-cut yes. A slip disc is another term for a herniated disc or protruded disc. So there's a lot of different terms that mean the same thing. So the decompression table that we talked about before definitely treats that problem. That's what it's designed for.
Oh, okay. Very good. Now, I will have to say, doctor, this is kind of a weird thing. Mm-hmm. You're not a face doctor, just a spine and neck. And I say that because I have a wound right here. I had a little argument with a sidewalk in the dark the other night, and tripped and fell right into a big lava stone in my landscaping.
Oh, no.
Yeah, it wasn't very good. This was 2 days ago, and I thought about waiting till tonight to see if he wanted to do some stitches, but you know.
Yeah, wrong doctor.
Wrong doctor. Okay.
We'll call plastic surgery.
Is there any last piece of advice that you would like to give our viewers who have neck pain, back pain that might help them?
Yes, great question. I think it's important for our viewers to know that if you're having symptoms, you're having trouble, and it's just not going away after a short period of time, it's much better to get things checked out sooner than later, because it's much easier for us as clinicians to treat things early on. We have much more success when we can treat things acutely and get things better and allow people to move on with things. If this is a smoldering problem that's been going on for months to years, it's much more challenging to treat, and it's harder for the patients too. So I would advise them that if it's not going away after a short period of time, it's time to get things looked at.
So if you don't take action yourself, you can cause more problems down the line.
We often see that, unfortunately.
Dr. Lutz, thank you so much for being with us here.
I always enjoy coming.
Isn't he great? You always get good answers from him and good advice. Now, next week, we have some advice for you. Northeast Coalition's going to be here, and they're going to be talking about advanced care planning. And, of course, they, too, will welcome any questions you might have. That's Wednesday night at 7:30. We've enjoyed your visit tonight. Have a great evening.